Now, let's talk about one of the major part of today's lecture, that is oral contraceptive pill, also known as hormonal contraceptive. And these are one of the most commonly used method of family planning or contraception all over the world. And this is taken by the female. Combined oral contraceptive pill or combined oral pill contain a mixture of ethinyl estradiol in a dose of 20 to 30 microgram and orally active progesterone or progesterone like norethistron in the dose of 1 milligram. That's why it is known as combined oral contraceptive pill. It has both estrogen as well as progesterone. The tablets are taken starting on the first day of the cycle for 21 days. So first day of the cycle for 21 days continuously. A new course of the tablet should be commenced 7 days after the cessation of the previous course. Now here for 21 days, the lady has taken it, isn't it? Now there will be a gap of 7 days. After 7 days, she should start it again. And so this is how it is used. They should be taken at a fixed time of the day, preferably after a meal. A fixed time is necessary, and there is a different reasons for that. One of the important reason is that she remembers, yes, this is the time to take the pill. Otherwise, there will be missing. There is a chance of missing of the pill, and probably the effect is also not that regular. Let's move on. Now, what is the mechanism of action of oral contraceptive pill? Every student know this. Now, see there. This is a combination of estrogen and progesterone. The combined oral pill suppresses pituitary hormones, importantly FSH and LH. Okay, so if FSH and LH are suppressed, then their effect on the ovulation, their effect on the ovary, everything is suppressed. At the same time, progesterone causes atrophic changes in the endometrium and prevents nidation. Nidation means implantation. This is just another term. It prevents implantation. Now remember, for the implantation, first of all, that endometrium has to go through the proliferative phase. After proliferative phase, it should go through the secretory phase. Now, sometimes students are a bit of confused. Progesterone actually developing that endometrium in the secretory one. Then why we are writing it atrophic? There is a reason. It will convert that proliferative endometrium into the secretory. It cannot convert endometrium directly into the secretory type. It cannot. Okay, so that's a mechanism. Progesterone also acts on the cervical mucus, making it thick and tenacious so that it is impenetrable by the sperm. So many times I have explained this mechanism. This is the role of progesterone. So there are multiple mechanisms involved here. Now, let's move on. Let's talk something more about oral contraceptive pills or hormonal contraceptive method. Pregnancy rate with combined oral pill is, just have a look here, 0.1 per 1,000 human years, which is the lowest of all contraceptives in use today. But they have to use it very correctly. If she misses it even on one day, okay, probably not much problem if she takes it 2 tablets the following day. But if she forgot even on that day, then she is no longer protected. And there is a false confidence, isn't it? I have taken the pills, so I cannot be pregnant. So that type of false security would be there. So because of this, still there is chances of getting pregnant. But according to the Pearl Index, if she takes it regularly as per the direction the chance of pregnancy is very, very less, or the failure rate is very less. If she forgets to take a tablet, she should take 2 tablets the following day. This is a very important message. If she forgets to take the tablet more than once in a cycle, she is no longer adequately protected and must use a barrier method during that cycle. This is a strong message we have to provide. Otherwise, we have given a good type of contraception, but that couple may land, okay, in the hospital. They may complain, why did we get, why my wife is pregnant even after using this type of contraception. It is difficult for them, for us to convince them, because the problem lies in them. A problem maybe lies in you also, because you have not convinced them properly. It is the counseling which is necessary here. One very important advantage of oral contraceptive pill is the bleeding is less in amount and shorter in duration than a normal menstrual period. That's why if somebody is having, excessive bleeding during the menstrual cycle, which is known as menorrhagia, this drug is used as a treatment. Oral contraceptive pill or hormonal pills are used as a treatment for this purpose. Now, what are the benefits, okay, of the combined pill? What are the benefits? Okay, so let's talk about it. It effectively controls the fertility. Yes, of course, there's no doubt. We have also studied the mechanism of action, and because of the scanty, okay, types amount of menstruation, it controls menorrhagia and polymenorrhea as well. It also relieves dysmenorrhea or premenstrual tension. That is also important one. Okay. Now, some other advantages or benefits of oral contraceptive pills are: it has proved to lower the incidence of benign breast neoplasia, such as fibrocystic disease. Fibrocystic disease. I'll take a class about the disorders of the breast in surgery very soon. So this is one of the benign condition there. It is a type of breast problem which is developed right at the time of menstruation or just before that. There's pain and a bit of tenderness in the breast. Okay, so it has proved to lower the incidence of those also. It reduces the incidence of functional ovarian cyst and ovarian and uterine malignancy also. So this is another advantage. The incidence of ovarian cancer is reduced by almost 40% and uterine malignancy by 50% if it is taken for 1 year. And this effect lasts as long as 10 years after the stoppage. This is a very, very important role. But remember one important point here: if I only give estrogen containing pill, okay, it is actually increasing the chance of uterine malignancy. But when I use the combination of them, okay, then the chance would be decreased. There is reduced incidence of ectopic pregnancy. The reason for that is because of mechanism of action. It suppresses the ovulation, and it also reduction, in the rate of PID and things like that. It is useful in acne, PCOD, and endometriosis also. All of that we have discussed before. Probably acne was not taught to you. It is a special dermatological topic. But remember, androgen plays an important role in the mechanism or pathogenesis of acne. And this is a estrogen and progesterone hormone we are talking. These are the female hormone. So it definitely antagonizes the androgen. That's why it can be used in the treatment of acne, especially in female. PCOD, okay, again, it is a hyperandrogenic state. And endometriosis, okay, to suppress the bleeding. These are one of the medicine which we use. Now, what are the side effects and contraindication for the use of oral contraceptive pills? Very important question which may be asked in the exam. Regarding the breast, the combined pills should not be offered to a woman suffering from cancer of breast. Very, very important point. If there is any family history, or if she has a past history of breast cancer and things like that, it should not be prescribed. Some have reported the breast cancer in a nulliparous woman. Okay, they have a rate of 25%, who has taken oral contraceptive pills before the age of 24 or over a period of 4 years. See this. So some cases have been reported that breast cancer has occurred in a nulliparous woman who has taken OCP before the age of 24 or for a longer duration, that is more than 4 years. So this is not a good choice in a nulliparous woman. Regarding the lactation, it is suppressed with the combined pills. The combined pills are therefore contraindicated in a lactating mother. Besides, the risk of thromboembolism is also high during puerperium. Now, let me clarify a little bit more here. See this. For the lactation, we need prolactin hormone. And prolactin and estrogens are usually, contradicting each other. Okay, they have the opposite of the effect. At the same time, this pregnancy and the puerperal period is thrombogenic state, and estrogen is increasing the chance of thrombosis. Okay, that's why, because of these multiple reasons, during the lactational period, hormonal contraceptives are not commonly used. Now, what is the effect in the liver? Now, you have already studied this point also. Okay, in surgery probably there is a chance of development of hepatic adenoma when the lady is taking oral contraceptive pill. This is known as hepatic adenoma. This hepatic adenoma, can rupture, and it can result in fatal hemorrhage, and that blood is collected in the peritoneal cavity. If she is having chronic liver disease like cirrhosis of the liver or chronic hepatitis, okay, or even the acute hepatitis which is causing jaundice, these pills are contraindicated because estrogen is metabolized by the liver. Regarding the gallbladder function, it adversely affects the gallbladder function also. So in case of cholecystitis, in case of gallstones and things like that, okay, it is not given. Regarding the carbohydrate metabolism, the carbohydrate tolerance may be reduced. It is reduced. Therefore, combined oral contraceptive pills are contraindicated or cautiously given to a diabetic woman. Or if somebody is having impaired glucose tolerance, then they can convert into a diabetic state as a result of oral contraceptive pill. Okay, these are steroid type of hormone, isn't it? So these steroid hormones have some adverse effect on the carbohydrate metabolism. Now, what about the lipid metabolism? Another interesting knowledge regarding the lipid metabolism. Estrogen increases the high density lipoprotein, that is HDL, and it lowers the low density lipoprotein. Is this a good thing or bad thing for the lady?
Sir, it is a good thing because of the high density are better than the low density, sir. HDL are better than the LDL, sir.
Very good.
Sir, HDL is a good and productive from the atherosclerosis.
Very nice. So almost every student know this point. Very good. Never forget it. We need more HDL in our body, and we need low LDL in our body. Okay, LDL is harmful. It is not as bad type of cholesterol. HDL is called good type of cholesterol. Actually, these are the lipoproteins, and they are carrying cholesterol with them. HDL carries cholesterol from the tissue towards the liver so that it can be handled there. whereas LDL carries cholesterol from the liver towards the tissues, and cholesterol can get deposited there, and that LDL can easily lead to atherosclerosis, which is responsible for 90% of the cases of myocardial infarction, even the stroke, even peripheral vascular diseases and things like that. That's why female who are in reproductive age group, okay, they usually do not suffer from atherosclerosis, or they do not usually suffer from myocardial infarction. But after they enter the menopausal age group, they are equally vulnerable like male. Some progesterone have a reverse effect, and the overall effect on the myocardium and the lipid depends upon the combined effect of both the hormone. Now, progesterone have a bit of reverse effect than estrogen. That's why we use them in a combined way. And a lot of the bad effects of estrogen are neutralized by progesterone and vice versa. Okay. The incidence of myocardial infarction therefore depends upon the type of pill used. So one lesson, if only progesterone containing pill is used, probably this effect doesn't last, but this effect doesn't appear at all. Headache, migraine, depression, irritability, increased weight gain, and lethargy can occur due to progesterone, especially migraine. This is quite commonly complained. Migraine is a type of headache. Okay, so if somebody is already having that complaint or that problem, then this type of drugs are not given. Thromboembolic disorder. This is another important point here. Pulmonary embolism and cerebral thrombosis, both venous and arterial, are around 7 to 10 times more frequent in the pill user than in the non-user in the first year of use. So clear-cut role there. This is due to increased clotting mechanism, that is by platelet aggregation and increased fibrinogen, as well as factor 7 and factor 8. At the same time, there is decreased fibrinolysis. So all of these are thrombogenic state, thrombogenic mechanism or state, and this is caused by estrogenic component of the pill. Now you may be wondering, see this, these are a bit of contradicting thing, isn't it? Regarding the atherosclerosis, okay, estrogen is not allowing that atherosclerosis to occur, but at the same time, it is enhancing the mechanism for thromboembolism, but still the chance of myocardial infarction, stroke, and peripheral vascular disease is very less common in the reproductive age group. Now, how can we explain it? Anyone? Did you get my question? The question is, isn't it? Estrogen is enhancing thrombosis or thromboembolic phenomena by this mechanism, but estrogen is decreasing the chance of atherosclerosis. Both are important risk factor for or the causes regarding myocardial infarction and ischemic heart disease or stroke or peripheral vascular disease. So how can I explain the point here? Anybody?
Sir, in lipid metabolism, here there is rules of lipid, so he is decreasing the lipid, bad lipids. But in case of thrombotic disorders, here it is affecting on the blood, so increasing the thrombosis.
Okay, I'll come to you. Any other student? They can speak something here if they like. Now listen here. Okay, this is a bit of tricky type of question I'm asking. The answer is pretty simple. Let's go to the cause of myocardial infarction or ischemic heart disease. 90% of the cases, atherosclerosis is the cause. That is the overwhelmingly common cause. The remaining 10%, it may be caused by thrombosis, or embolism or vasculitis or something else which are unexplained. So it clearly tells you, give you the answer. Yes, because of this, embolism and thrombosis, it may result. But just think about it. This thrombosis usually occurs in the deep veins of the lower limbs. They are the most common site for thromboembolism. Where that clot will go, even if it occurs, where it will go? Yes, where? It will go to the
Deep where?
It will go from the deep vein. It will go into the inferior vena
Pulmonary
cava.
circulation.
Exactly. From the inferior vena cava, it will go to
Paradoxical
the,
embolism.
yes, right side of the heart, isn't it? Right side of the heart. From the right side of the heart, it will go into the lung, into the pulmonary circulation. That is the most common way. And very, very rarely, there is a phenomenon known as paradoxical emboli. If there is some septal defect, then only it will go to the left side. And from there, entering into the coronary artery is very, very uncommon. Yes, it can happen. Anything can happen in medicine, but that is extremely uncommon. That's why even if there is a chance of thromboembolic disorder, the chance of myocardial infarction is extremely rare in case of reproductive age group because of the effect of estrogen. Now, we are coming, towards the end of this lecture. Still, few more things have to be discussed. These are the conditions where oral contraceptive pills are contraindicated. Now, after going through all these things, we can nicely list them. Cardiac disease, hypertension, and smoker over 35 years. Okay, we preferably don't give them. Some ladies who smoke, okay, we don't use them because smoking itself is a risk factor for so many other things. On top of that, you add the effect of OCPs. Diabetes, history of thrombosis, myocardial infarction, sickle cell anemia, or severe migraine, they are contraindicated. In sickle cell anemia, there is already a lot of thrombosis going on inside the body. We don't want to increase that. Chronic liver disease, okay, any type of liver disease, they are contraindicated. Breast cancer or gallbladder disease, they are contraindicated. Gross obesity, because it further enhances the weight gain, contraindicated. Patients on enzyme-inducing drug like rifampicin and anti-epileptic drugs, okay, except sodium valproate, they are contraindicated. Now, let me ask this. Probably many of the students know this fact here. Why? The rifampicin, phenobarbital, or phenytoin, okay, are not usually combined with oral contraceptive pill. Why is that?
Sir, because these drugs induce the action of the hepatic enzyme, which is mainly responsible for the metabolism of that oral contraceptive pills. Sir, that's why they decrease the half-life of the oral contraceptive pills and lead to the unwanted pregnancy.
Very
Sir,
good.
may I, sir?
Yeah, sure.
Sir, we know, like said, they're metabolized in the liver with the help of cytochrome P450, sir. And so this rifampicin will go inside and so it has some sort of hepatotoxic ability. So it will affect that cytochrome P450, sir. There will be no metabolism, sir, and that's why, sir, we cannot give the OCP with the rifampicin, sir.
Exactly. Both of the students have answered it absolutely correctly, and this is the way. Very nice. Never forget this. This is one of the questions which is asked to you by every possible teacher. Now, there are certain drugs which are inducing the hepatic, microsomal P450 enzyme system, and they metabolize other drugs which we have given together very rapidly. And the perfect example is oral contraceptive pill. So rifampicin, phenobarbital, and phenytoin are some of the drugs which stimulate that hepatic microsomal P450 enzyme system so that it will rapidly metabolize oral contraceptive pill. Now the lady is under false assurance. Yes, I have taken the medicine and I am protected by that. But actually, the protection given by that drug is no more because the half-life is much severely reduced. So if we want to combine this medicine, we have to give a bit higher dose than necessary, or avoid that medicine altogether and go for the alternative one. Yes, go for the alternative one. Like IUCD is the alternative one. Barrier contraceptives are the alternative one, like that. That is the meaning. Sodium valproate actually inhibit that mechanism rather than stimulating. Another contraindication is 4 to 6 weeks prior to planned surgery, lactating women, and even the vaginal candidiasis, because estrogen will increase the chances of development of candidiasis. Now we have come towards the end of this very important topic in gynecology. Let's talk about postcoital contraception. Sorry, they are also known as interceptive. Postcoital contraception. Now, what is the meaning? Postcoital contraceptive agent interfere with post-ovulatory event leading to pregnancy and is therefore known as interceptive as well. And they are taken after the sexual intercourse has occurred. That's why it is known as postcoital. Now, they have not used any method of contraception during sexual intercourse, or they have taken, but they are not quite certain about it, certain about the efficacy of that agent. For example, condom was used, but it ruptured, it burst, okay, or it slipped, something like that. So they want to be absolutely sure that fertilization or pregnancy doesn't occur. And this is one of the scenario where postcoital contraception can be used. It is also known as emergency contraception. Okay, emergency contraception is another term for this. You see there, which is used to prevent pregnancy after an unprotected intercourse. Emergency contraception is used following rape, unprotected intercourse, or accidental rupture of a condom during coitus taking place around the ovulation time. Now, this is the thing every student know, but how to give this protection? Okay, let's talk about it. The preparation available include 2 tablets of relatively high dose of combined oral contraceptive pill, which usually contain 100 microgram of ethinyl estradiol and 1 milligram of norethistron, or 500 microgram of levonorgestrel. These are available. You don't need to know the dose also. Just go to the medical shop and ask for these. It is already available there. But they should be taken within 72 hours of intercourse, followed by 2 tablets taken 12 hours later. So if we follow this particular step, then the chance of failure rate, see there, is very minimal, 3.2 per 100 human years. This is the failure rate. So within 72 hours of intercourse, this medicine has to be taken. Okay, and it should be followed by other 2 tablets 12 hours later. The mode of action, we don't need to discuss. We have discussed it so many times already, because these are the same hormones which are used here. Now, another types of emergency contraception, okay, is levonorgestrel. Levonorgestrel alone. Now, this is a type of progesterone we all know. So only 1 tablet should be taken within 72 hours of unprotected intercourse, and another 12 hours later. Okay, if she doesn't want to take it like that, then 2 tablets can be taken as a single dose. And look at the failure rate; it is even lesser than the combined pills. So this is levonorgestrel. It's a type of progesterone. Another is RU486. Okay, RU486, also known as mifepristone. Now, this mifepristone is a steroid with an affinity for progesterone receptor. So you can also call it progesterone analog. It doesn't prevent fertilization, but by blocking the action of progesterone on the endometrium, it causes sloughing and shedding of the decidua and prevents the implantation. So this is the mechanism of action, because it has got affinity for progesterone receptor. So it is doing these action by this effect. Now, what is decidua? Decidua means what?
Modified endometrium.
Good, very good. This is a modified endometrium, or you can say this is the same name we use for secretory type of endometrium, which is developed there as a result or as the effect of progesterone hormone. Decidua bassalis is one of the important part of placenta. This is the maternal component of the placenta. So it is a part of the uterus. A single dose is effective in preventing pregnancy in 99.1% of the cases, and the failure rate is just 0.9%. So among all of them, the failure rate is minimal in mifepristone or Ru-486. But it should be easily available. That also matters. For example, one couple, okay, they are not sure about this one, and then they went to the medicinal shop and asked for all of these, but it should be available there at that moment or that time, isn't it? And oral contraceptive pills are very easily available everywhere. Okay, but these days all of these drugs are available if that medicinal shop is a little bit of quality one or better one. This is the last slide for today. Now, another method also exists, okay, as a emergency contraception or interceptives, that is copper T type of IUCD. Copper T type of IUCD. Now, how does it work? It is inserted within 5 days of intercourse, and it can prevent implantation of a fertilized ovum. The advantages of this type of emergency contraception are it can be inserted as late as 5 days. So this definite advantage. Okay, it is cheap. Failure rate is very, very less, 0.1%, and it can remain as ongoing contraceptive method for 3 to 5 years. But remember one important fact here. This postcoital, contraception or emergency contraception is usually used by the quite young people. Okay, so we already talked about IUCDs are contraindicated in younger female before she got pregnant. Okay, even before the marriage, this type of contraception are not used. So according to the discussion, the best one is still the hormonal type of contraceptive regarding the emergency contraception than this type of IUCD. Though the effect is very good, but it is a cumbersome method to put it inside, number one. And number two, it has some chance of complication as well. Okay, so with this, we have completed this discussion of contraception.